All right, welcome back everyone to another virtual shadowing session. Actually, today we're going to have two sessions. Each are going to be separate. Our first is going to be with Dr. Shah. We're joined by him today. He's the Secretary of Health for the great state of Washington. A few reminders I want to give before we do get started with our session today. Today's session is a bit shorter. It's going to be 30 minutes. So with that said, our quiz will also be shortened. Instead of the usual 10 questions, we're going to have 5 questions, still the same passing rate, 60%. So three or more questions out of those 5 will allow you to earn your certificate in recognition of your attendance. Towards the end, we'll have a Q&A. It's going to be a shorter Q&A, just like our session generally. So if you have any questions, feel free to type them in, but we might not get to all of them. If you want to stay tuned with us in the future with other shadowing sessions, feel free to follow us on Instagram or join our listserv. But those are just a few reminders I wanted to shout out. With that said, Dr. Shah, feel free to take it away.
Michael, thank you. Can you hear me?
Perfectly.
Fantastic. Well, it's great to be here this afternoon, evening. I don't think it's morning anywhere, but at least I can say afternoon, evening. Michael, I can't see who I'm talking to. How many people am I speaking to right now?
Well, we live stream on YouTube, so they'll usually trickle in. We have around 10, 15, 20 students who go live, and we'll have a lot more watching after.
Okay, perfect. Well, I am going to, first of all, just thank you for having me be a part of this session. It's great to connect. And, as you know, I've spent 25 years in Texas, and just coming to the great state of Washington. I do miss the great state of Texas as well. It's been an incredible journey of both new opportunities, but also missing the people, especially that you connected with for so much time in Houston. So I'm going to share my screen if that is okay. And my hope is that I do this well. And I have my colleague, Tony Castaneda, who's going to help me so he can show me exactly where my presentation is. Since it's his computer.
While we wait, do you want to maybe just kind of go through your time in Texas? I know that you worked previously in Harris County, right? How was that for you?
Yeah, I'm actually going to build all that in. How's that sound? I promise. And I'll go very quickly, in the interest of time, I'll go very quickly through this. And then what I'd like to do is to spend a little bit more time with answering some questions that may come up in the midst of all this. And if I can, let me just start by, again, thanking all of you for being here this evening, this afternoon. My name is Umair Shah. I'm the Secretary of Health for the great state of Washington. And I do say that carefully because I do think the work that we're doing in Washington is fantastic. I'm very proud of the community that we have here. If you haven't been up here, obviously Seattle is what everybody knows Washington for. There is Mount Tahoma, also known as Mount Rainier. That's in the background there. And then beyond that mountain range is what really is interesting is the rest of the state. And we have so much diversity when it comes to communities in eastern central Washington, as well as in southwest Washington and northwest Washington, where we have a number of islands. So it's a beautiful, beautiful state. If you have not had a chance to visit, I know it's at least a little cooler in Washington than it is in Texas right now. Cornerstone values that I believe very strongly in, that we've incorporated into our Department of Health, are equity, innovation, and engagement, and I'll refer to that as EIE. We are so impressed by the importance of starting and centering with equity, that innovation and creativity, including technologies and people, are important for enacting and ensuring innovation. And then we are also equally recognizing the importance of doing this together with our partners, and that we have to engage as well. You may know this, that This is the IOM definition of public health. It's what we as a society do collectively to ensure the conditions in which people can be healthy, and you can put in parentheses, safe, secure, well, protected. There's so many words that come to mind, but truly this is the word collectively is the key word here on this slide. We know that there are public health challenges that do not recognize borders, whether it's something about climate or it's environmental health, policies, infectious diseases, vectors. But our solutions also have to recognize the interconnectedness of that work. And I will talk about global health when I talk about our transformational plan that we just released a few weeks back. So who am I? Michael asked me to talk a little bit about this. I am a physician by training. I spent 20 years as an ED physician at the Michael E. DeBakey VA Medical Center in Houston. Spent a lot of time in my training was in internal medicine, primary care, and spent a lot of time in community health clinics. But I found my passion in acute care medicine and emergency ER work. I will tell you that it's been a passion of mine, both for individual patient care, but also population health and systems. Spent time both in obviously my medical training, but also just like many of you clinicians, but also spent some time at WHO, World Health Organization, headquarters in Geneva, and also recognize the absolute importance of responding for emergencies. The bottom left is when we were responding in Harris County for a number of emergencies, but also Hurricane Katrina response when I had hair and it wasn't so gray, with an official forum during Hurricane Katrina response at the Astrodome, where we had, as you know, 20-some thousand people that were at the Astrodome. And what we did was a lot of really innovative work, and it wasn't just about the widgets, but it was also about using common sense, but also the work that I've done globally, whether it's in Kashmir or in Haiti and other responses, and just recognizing the importance of this work with global and domestic interconnectedness, but also responding for the health and well-being and protection of our communities. Who else am I? I didn't put these images together, so I don't want to take all the credit or discredit of again the pictures, but I will tell you that it has been a journey with Hurricane Katrina being probably the most critical piece of some of the work that's happened. And I will tell you that includes in the middle there this no exit after ever allowed without public health approval. It was just a reminder of the importance of healthcare and public health coming together, even in the midst of an emergency, testifying in Congress on hurricanes, and obviously responding with various elected officials. There's just so much that we do in public health, and public health is inherently political, and we have to keep that in mind as well. Other things that previously in Texas, working with innovation, our Phi Lab, Public Health Innovation Lab that we put together, as well as working with Microsoft Research on these smart vector traps that really with the wing oscillation of a mosquito could determine whether it was the West Nile virus mosquito or whether it was the Zika mosquito, and then trap it for an incredible amount of analytics. Also working with Harris Cares and putting this report that was a landmark report in 2019 together. It was very much a 10-year vision for health in Harris County, which, as you know, is an incredibly diverse and such an amazing community in the Houston metropolitan area. So the work is very much about all of what we have been doing. But as you know, public health over the last 2.5 years has really been challenged by this pandemic. And I really say this very carefully. I was featured in the New York Times Magazine in the summer of 2020 with why we're losing the battle with COVID-19. And it was very much talking about this invisibility crisis that we have, that we're the offensive line of a football team when largely people don't know what we do and what we do, why it matters. And I think it's really critical when we talk about public health that we have a better understanding of the value proposition of what we do as a system, so people know why we're important and why the work we do should be valued. And that is tough when you have politicizing and you have pandemics and you have all sorts of people and processes. Notice all the P's of alliteration, so that we are doing everything we can to respond on behalf of our communities. So this invisibility crisis, and I used Russell Wilson before he was traded to the Broncos. I should have used Joe Burrow, my Cincinnati Bengals quarterback. I have to give a shout out to my Cincinnati team that got to the Super Bowl this past year. But just recognize that everybody focuses on number 3, the quarterback, the healthcare system, if you will. And so as medical students, your doctors who are going to eventually be number 3. And people are going to listen to you because of your knowledge or your degree, or your stethoscope is on around your neck and you're wearing your white coat, and people are going to recognize the importance of what a physician has to say. But we also have to recognize that the quarterback cannot do his or her job unless the offensive line is strong. And that is what public health is. We're the offensive line of a football team who are blocking and sweating and doing all sorts of things in the middle of the night or in the light of day to make sure the quarterback can stay upright. And if we do our job well, oftentimes you will not even know that we exist. And that is the invisibility of our system. And so it's a real challenge then when people don't know what we do, how should they invest in what we do? And so to solve that problem, I've come up with this concept of the 3 V's of public health, where we raise the visibility. When you raise the visibility of something, people value it. When they see it, they value it, they touch it, they feel it. And when you value something, you validate it with pro-health policies, pro-health resources. And that's what really is truly what public health is about. It's protecting the rest of society. And that is what we do every single day. But it's also political. And whether that's in Texas, with what absolutely occurred during this pandemic, whether that is in Washington, which absolutely occurred during this pandemic, or whether it is at the federal or global level, that there is so much that has inherently reminded us that not of just the 3 V's, but that 4th V of virus, or even the 5th V with the George Floyd murders of violence, that public health is ever required to do its job. We have to recognize the importance of the political aspects of the work that we do. So Texas to Washington was a very difficult transition. I arrived 4 days after vaccines arrived in the state of Washington. I left Texas, where I'd been for 2 decades, picked up my family, our puppy, and packed the bags and headed west, and left Texas after fighting on the front lines of COVID-19 for this first year of the pandemic, and then the last year and a half plus fighting at the state level when Governor Inslee asked me or appointed me to be the Secretary of Health for the great state of Washington. And I think it's really important to remember that as a practicing physician, someone who's trained and worked in healthcare, and to come in now into a public health or a health secretary setting reminds us of how important it is for public health and healthcare to be intertwined and to work together. So, what has that meant? That has meant a lot of learning on the fly, right? Leaving behind hurricanes and humidity and heat, coming to a state where you have mountains and lots of rain and all sorts of other things. But one of the things that's really been incredibly invigorating is just the fact that Washington has so many incredible people doing so much work, and such a belief in the importance of public health and also the importance of community and coming together. we have to ultimately build trust through community engagement. And I think this is so critical when we think about what has happened with respect to even the CDC and even this recognition of the importance of CDC and the work that it does, but the politicized nature of the environment, that we have to stay above the fray, that whether it's west or east or left or right or red or blue, we have to be above the politics of the work that is occurring every single day. We also have to build trust through our media partners, because the media partners oftentimes are the ones that actually get that word out to the community. And we've done a lot in the state of Washington to make sure we've had an opportunity to be able to provide feedback, provide information, and to do everything we can to get that information to the community, especially when the community has questions about the work that is happening or how it's impacting their own lives and their own families. And it's also about community. And I really love this concept of together, right? Community and that unity that really comes to mind when we are referring to the importance of all the places that health touches, where I always love to say that public health is very much about community, but it's also about where we live, learn, work, worship, and play. It is not at the global level. It is not at the federal, national level. It is not at the state level. It is not at the local level. It is at the community level that health really reminds us of how important it is that we continue to engage with community members. During COVID-19, we responded, and I'm very proud of the response that we had for COVID-19 in our state. We, in March, submitted a plan called WA Forward, as really looking ahead through the end of this year about the kinds of things that we wanted to do to make sure that we were responding to COVID-19. And as you can see, we have been one of the top states when it comes to COVID-19. In fact, much of what you see here, but also with respect to the Commonwealth Fund, has shown that Washington State has had what they said the number 4 response when it comes to COVID-19 in the country out of 50 states, and number 3 when it comes to lowest excess mortality. We should be very proud of that. Tens of thousands of Washingtonians are alive because of the policies that we have put in place. But it has been at a cost, and there has been an economic and a societal cost to all the different things that we have unfortunately had to do in order to fight this virus. And if you think back to where we were prior to this pandemic ever happening, I think we can all agree that we will never look the same because of how this pandemic has changed all of us. But it has also reminded us that we can't just rest on our laurels about a pandemic. We have to think about transformation. And I'll talk a little bit about this in a bit, which is that we can either see the end of this pandemic in 2 different ways. They will both see the end of the pandemic. One is transactional, that we finish the pandemic and we're one and done. We look at the next headline, the next shiny object, or we can be transformational. And that is really about taking a summation of everything we've learned and move forward in a way that's going to allow us to build on those EIE cornerstone values, but also to transform our systems as we move forward. So we just released this transformational plan in the last week and a half. And so it's very exciting for us to create this vision for health in our state. Our priorities are 5-fold. One is health and wellness, the full physical, mental, social well-being for a person or a community member. The second is health systems and workforce transformation, that our health ecosystem is robust and responsive. And then third is environmental health, which is very much the broad range of healthy environments, whether natural, built, or social. And the fourth is emergency response and resilience, that we have to be prepared for, respond to, recover from a whole host of emergencies, but to be able to do that in a way that's going to create resilience for those very communities and community members who are then facing the emergencies at hand. And the fifth is global and One Health, that we are ever connected in our environment. What happens in the state of Washington or the state of Texas has impact elsewhere. And what happens elsewhere, we have so much to learn in our own communities. And that there is an interconnectedness of humans, animals, and the environment, which is what One Health is about. And we are doing everything we can to bring those connections, global, domestic, as well as One Health together. These are our 5 priority areas that create our vision. Each of these priority areas have then a commitment under them. So a commitment for health and wellness, a commitment for environmental health, for example. And then each of those commitments then have 6 action items. What are we going to do is critical, but these action items are how we're going to go about doing it. So health and wellness, it's the what. It's the 6 action items that show us the how we go about doing that. And that's really critical for the work that we do moving forward. And I think the last thing that I would say here is the importance of, again, transactional health to transformational health. What do we need to do as a society, as a system, to really transform health for our communities on behalf of our communities, calling out all the different challenges, but also recognizing it's not about talk, it's about action. So I'm going to close with just saying that it takes a village when we work together, and that's what public health is all about. That's what healthcare is all about. As a practicing physician, I will tell you that I have recognized throughout my career the importance of healthcare and public health coming together. We have to go into this with a hashtag in it together. We cannot forget the interplay of public health and healthcare with that invisibility crisis that I spoke about. But we also have to recognize that public health has its inherent place, and we raise the visibility, the value, we will and need to validate it with pro-health policies or resources or both in order to invest so we can continue to be ready to protect the health and well-being of our communities. I hope you'll follow me on Twitter, UShahMD, or our official accounts with WA Health Secretary, WA Department of Health, and this is a way to reach me as well. So this is our executive leadership team. You see that picture? I'm just so amazed by the dedication and all the people coming together for the importance of the work that we do. And I just hope that you will continue to carry on the legacy of why we need to create better futures for the communities, especially for the next generation of people. And so with that, Michael, I'm going to stop, and I hope this is helpful, and I will turn it back to you for any Q&A.
Absolutely. Well, first of all, thank you so much, Dr. Shah. It's not many times that we'll see public health or anything to do with like community medicine, community health on virtual shadowing. We have had a few about it, but we're glad to have your experience on board and hear from it. One of our first questions is, you mentioned earlier on when introducing your background, you worked in the ED in Houston earlier as a full-time physician. What was the motivation to change from there?
You know, I will say that I've always felt the importance of public health and maybe not appreciating it. One was really, again, just the reminder that, you know, when you're in a healthcare system, oftentimes it's a sick care system or it's an injury care system, right? That, you know, you wait for somebody to get sick or get injured, and then they come into your emergency department or a clinic and you say, okay, now I'm going to try to remedy you and fix you, rather than thinking about what is it that we can do in the community in order to be able to prevent somebody from getting sick or injured in the first place. So I think there was that piece. The global health work at WHO really crystallized it during my medical training, where I had this thirst and passion of really trying to put systems together and pieces together. And I felt it was so important for me to have an advocacy voice of being able to work so that I could help change systems and evolve systems. And then the third is that I really think it comes back to when I was growing up. There was a lot that my parents taught me, but one of the things they taught me was my sister and I both was that, and I've tried to pass this along with my wife to our kids, is the importance of both doing good and doing well, right? So doing well is that you hit it out of the park, you get straight A's, you get the highest board scores, you do everything you can. And that's critical. And I know it's critical for everyone's watching, right? But we also want to make sure that we are doing good, that you are putting it to a mission, a work to be able to help people. And I have been about saving and protecting lives my entire career, whether it's an individual, my veterans who would come in, and I'm so proud of being able to serve for 20 years, veterans in our country, or any of the clinics I worked in to serve the people that were in that setting and an individual for the crisis they were having in their own healthcare issue. But then if you expand it, the community of individuals, where the community becomes our patient and trying to help save and protect lives for a population. And so bringing that all together is how I made that sort of overall transition. I got my master's in public health at University of Texas. And at some point it was sitting there, and I thought, I'm not aspiring to be the ER medical director. I don't want the medical director's job. And whenever you don't aspire to the job of your boss, that's usually a sign that you've got a different field. And so my advice to medical students is pick your passion, and realize that medicine and health are so broad that you have so many opportunities to go in different directions. Explore those opportunities, because you may start with, this is what I want to do. You may want to go into orthopedics, or you may want to go into OB/GYN, or you may want to go into pediatrics, and you may come out and realize that you want to be a psychiatrist. And that's okay, but you won't know that unless you explore. So just wanted to add, and I think that's how I made that transition.
Absolutely. I don't think people realize it enough, but like you mentioned, I just want to reiterate, if you don't want to become the boss that you have, it's a field that I guess you only want to go to a certain extent with. I think not enough people realize or take away from that analogy and apply it to life. One other thing I wanted to ask, and we usually will ask this for many speakers, it really applies across fields. A lot of students feel like they are limited, being especially that in the pandemic, they were not necessarily even able to get clinical volunteering or shadowing. But even being undergrad students, even being before that first step in medical school, how can they take steps to exploring public health, like you mentioned?
Yeah, I think Michael, you bring up the probably the most important point, which is to get involved. Every health department right now, especially, is struggling with workforce, staff, team, people that they're on fumes. I mean, for 2.5, 3 years of responding, and then undervalued, vilified in many ways, attacked at times. So there are times where people will say, well, why would you want to go into public health? One, because of what I just talked about, mission, that you can do so much for so many, right? But number two is that if you are interested, please explore that interest of yours in a formal way, meaning please do your best to volunteer. Go to a health department, make contact, say to someone, hey, I'm a student, I'm ready to give some time. I can do every Thursday for 4 hours, or I can do Tuesday and Thursday from 8 to 10 on these 2 days. Is there something I can do to get plugged in? And I guarantee you that health department will find a way to plug you in. And the needs right now are so great that I'm sure there is an opportunity that's right around the corner. So get involved.
And maybe we can just end off on one more question, because I know you're tight on time. Yep. So
I'll give you 2 questions. How's that? 2 questions.
Perfect. So you mentioned first working in Texas and then moving to Washington, but across the states, what does your collaboration look like? Even being a Secretary of Health for specifically Washington State?
Yeah, well, I mean, I think it's important for us to be interconnected, just like you would expect if you were if you're on the wards and you're the internist or the hospitalist, you've got to make sure that the nephrologist or the orthopedic surgeon or the cardiologist or the name any specialist is going to be, or even primary care fellow provider is going to be with you. It's a team, right? We work as a team. And I see that as the same as when we're looking at across the country in our field, that we have to continue to do that. And so many of the secretaries of health, we come together through an organization called ASTHO, ASTHO, the Association of State and territorial health officials, which represents all of us. And what we do is we meet right now virtually, but we meet on a weekly basis, and we share ideas, we share concerns, we share challenges and issues. And as you can imagine, during the pandemic, there were times we were meeting every day. And I think it's important for us to continue to share so we can learn. Washington can learn from what's happening in Vermont, and Vermont can learn what's happening in Washington. And that's, again, the reason why the global domestic piece is so important, that we shouldn't just limit ourselves to the United States. What's happening in Canada, what's happening in other parts of the globe also can have impact on the work that we're doing. And we want to learn those lessons as well.
Absolutely. I'll hit you with one more question. And I wanted to ask about, you mentioned earlier on when you were introducing yourself, like I said, you started out with 30 years. Was it 30 years, right?
20 years.
20 years. Okay. In the emergency room.
You just gave me 30, you gave me another 10 years of career. So I must look older.
Yeah. Well, from that, I wanted to ask, do you think that there was anything that you learned that you couldn't have taken away if you had immediately gone into public health? Was there any necessity that you think was from those 20 years of practicing as a physician with one-on-one patient interactions?
Yeah, I mean, to be clear, that some of the work I was doing was concurrent, right? It wasn't sequential. It wasn't like, because then I would be markedly old. I'd be ready for retirement if I had to wait 20 years, and then on top of that, my 17, 18 years of public health, and it would have been a 38, 40-year career. So I'd look a lot older, right? Unless I started at the age of 5. So I do think that some of it was, while I was doing healthcare, I started to do public health and continued healthcare as long as I could, all the way through the beginning of this pandemic, frankly. And then recognizing that public health continues to shine. I chose public health. In many ways, public health chose me. My background, immigrant background, seeing communities of color that have gone through various things, my family going through various things, recognizing the importance of not just what's happening within the 4 walls of a clinic or an emergency department or a hospital, but that health happens in the community. What I learned and gained as a doctor, as a physician, I absolutely could not have gained that in any other way. You know, when you think about healthcare, we're charged with, we're responsible for these very delicate decisions that have impact on people's lives and their families' lives, their communities' lives. And, you know, if you don't do it well, something bad's going to happen, right? If you give the wrong medicine, or you do the wrong thing, or you look at the problem incorrectly, it's life and death. You know, especially in the emergency department, when you're running codes, right? It's life or death. But at the same time, we don't always appreciate that in public health, it's very similar. It just happens in a longer term, right? And the pandemic has shown us why those decisions have impact. Probably the most acutely, because the pandemic was about decisions that had impact on people's lives, and you could see it right then, versus usually public health, you know, we'll put in an obesity prevention program. You may not see the benefits of that for 20, 30 years, or for the next generation or 2 generations later. So I do think it's important for us to bring the tools that we bring as doctors. And my advice is, in addition to do good, do well, my advice is that you should also, and do good, do well, and your passion for what you want to do. My advice is that explore and be ready to lead. But whatever you do, have a global look. And I don't mean just global as in international, global look at the field of medicine and health and healthcare. and really think about the pieces that connect, the policy pieces, the administration pieces, the population health pieces, and how those intersect and come together, because ultimately that's how we will impact health in our communities. We can't do it alone in public health. We can't do it alone in healthcare. If you think about Dallas during Ebola, if public health had not done its job with Mr. Duncan, who had gone to Presbyterian Hospital for emergency care when he had some symptoms that could have been Ebola, and it turned out it was, and there was a smart nurse who picked up on it. That is a story of healthcare's success. But the fact that we had, outside of 2 additional nurses, no spread of Ebola outside of those 3 individuals in the continental United States, unless it was somebody who had been infected internationally, that's a legacy of public health success. But here's the difference, Michael. When healthcare does that, we say, good job, you did it, congrats, we got it. Because it's easy to say, I treated cancer in a patient. But how do you show the null hypothesis of not a picture of a boy or a girl who you treated cancer, but of 1 million kids who you prevented cancer in the first place? That's the value proposition that is very difficult for people to recognize. And that's why we have to raise the visibility of our work, and also why healthcare and public health must come together. So I hope that helps. This has been it's hard to have conversations with when you don't see everybody. So I hope this is helpful. But Michael, this has been really fantastic to be able to talk to you. And I hope you all will consider a field and a career in public health. And if you don't, at least, or you're not sure, at least volunteer so you can determine whether it's the field for you.
Absolutely. You never really know unless you try.
There you go. Good advice.
Of course. So I have a few reminders for everyone just before we wrap up. For those who are shadowing with us and they're new to the program, we have our quizzes, like I mentioned in the very beginning. We'll have 5 questions just because this was a shorter question. Those quizzes must be passed with 60% or more. There are 5 questions, so that's 3 out of the 5 questions or more. To earn your credit for attendance, you'll receive a certificate. That certificate will be sent to the email that you list in your inbox. And that quiz will be due at 11:59 p.m. Central Standard Time this upcoming Wednesday, August 24th. That quiz is posted both in the chat box and also on our website. On our website, we now have the Monday quizzes and the Thursday quizzes both posted and separate, so you can access them without any worries, because the deadlines do overlap. If you don't find your certificate, just in case, check your spam folder. And even if it's not there, feel free to reach out to us. Our email is shadowing.h4h@gmail.com. And for our next shadowing session, we're going to be joined today by Dr. Lindquist, who's the state epidemiologist for communicable diseases and deputy health officer for also Washington State. That's going to be from 7:30 to 8:30 Central, also to hear more about public health. Also, like I mentioned at the very start, if you want to hear more about our sessions, they usually run on a Monday and Thursday schedule at around 7 o'clock, but the times will vary, just like this one did. You can follow us on Instagram to keep an eye on future session announcements and also other program announcements, or subscribe to our listserv either by emailing us with your name and email address to our shadowing.h4h@gmail.com email, or you can just subscribe onto our subscription form, which is something that we have at the bottom of each page on our website. With that said, though, that's going to wrap up our session today. It was a shorter one, but definitely very, very insightful. We hope that you took away from this, and hopefully you learned a little more about what it is to be involved in public health. We are honored to be joined by Dr. Shah, who is the Secretary of Health for Washington State. So it was a really great session. We'll see you guys later on at 7:30. Again, it's going to be Central Time, so just keep an eye on the time zones. But until then, enjoy.